Now we're going to speak about the Quadratus Lumobrum tender point. The Quadratus Lumobrum tender point, it's a quite common dysfunction on your patient. Usually, like 80% of your patient going to have this tender point. Many times this tender point is bilateral. Where do you find this tender point? Well, first we have to say that the Quadratus Lumobrum muscle is a quite thick and big muscle which originates from the inferior aspect of the last ribs and at least the first 4 transverse processes of the lumbar spine. It wraps down and it inserts on the anterior edge of the iliac crest. So what the function of this muscle is, it's a very powerful side bender. How you locate this tender point? This tender point can have 3 regions where you can find it. A first region is approaching the patient lateral between the iliac crest and the last rib, approaching in lateral, hitting on all the transverse processes. Usually the most common place where you're going to pick it, it's around L2 or L3 transverse process. Another area where you can pick this tender point, it's in a triangle in between the 4th or 5th transverse process of the lumbar spine and the iliac crest, in this triangle here. While the third region where you're going to find it can be in another spot, in another triangle, in between the first lumbar spine vertebra and the side of the 12th rib. So in this corner over here, as we can see in this other image here, you can see the muscle, as I showed you before, goes down in this direction and inserts on the inner side of the ilium crest. So one way of approaching is like so, another way you're going to approach is in this area here, and a third part is in this triangle here. Now, Quadratus Lumobrum tender point, this common dysfunction, usually can give complaint in the right area of his tender points. Many times the patient come in shifted to the side where the tender point is more hot. Many times side bending towards that side is free, while side bending to the other side it's commonly painful. Usually the patient refers like deep pain inside the muscle, like stabbing pain. But many other times the pain can be referred on your buttocks. Other times you can have refer on the inguinal region and on the testicle too, as if the testicle was pulled up from that side. Every time the patient comes in with this kind of complaints, go and search for a Quadratus Lumobrum muscle. Many times this muscle and the tender points are hot. Since he's shifted this way, he does not like to go in this other way. In strain and counterstrain, we get what is crooked and we make it crookeder. So what we're gonna do in this case here, we're gonna side bend even more to the dysfunction position, so to shut off this reflex. Quadratus Lumobrum tender points are very, very important for all the herniatic situation on the lumbar spine. Why? When there's an herniatic disc, the reaction of the body is to tighten up all the muscle, so to stabilize the column so that it doesn't move, it doesn't shift. In this way, the body tries to protect. But what happens in this situation is that when the Quadratus Lumobrum muscle are tight, both sides, they're gonna compress and squeeze the discus even more, and this will create more pain on your nerve. So when this is the case, always free the Quadratus Lumobrum on both sides, first starting from the hottest side. Even go in front and check for the psoas muscle too, because even the psoas muscle, usually when there's an herniatic disc, they're tight too. So creating this balance of tissue will decrease the compression on the lumbar spine and will decrease the aching pain on the root. What is the sensation you're gonna feel underneath your finger when you're gonna find these tender points? Usually for the tender points, on the transverse process of the lumbar spine, you're gonna feel for thick, dense tissue overlying the bone, which is very sensitive for your patient. While instead, in the first area here and in the other area here, the sensation usually is like a tight spot in with the muscle, always quite painful for your patient. How you treat the Quadratus Lumobrum tender point? Many times your patient can come shifted to the side where he's in pain. Other times this is not so necessary, maybe just as he's complained on his buttocks or in his inguinal region, as I told you before. Sometimes you can even test them in side bending, see which side bend is freer and which one is more limited from tension or pain to which side. How to locate the Quadratus Lumobrum tender point? To locate this point, as I told you before, there are 3 areas where you can pick the tender point. The first area is in between the iliac crest and the 12th rib, which on Earth is right here. So you have this spot where you enter from lateral to medial. Here is her spine. You go down deep until you hit the transverse processes. And this one is a bit painful on her. In this area here, I probably will gonna be on L3 or something like that. So from here is a first point. Then I can slide my thumb up and search for another spot here, which is a little bit tender. I can slide my thumb in this direction and search for another spot here, so I'm sure to see all the points on the transverse processes where the Quadratus Lumobrum inserts. Then the other spot is in the triangle in between the 12th rib and the lumbar spine, this time pushing perpendicularly down, which is a little bit hot but not so hot. And the last point is in a triangle in between the iliac crest and the lumbar spine. Even in this area here, you're gonna push perpendicularly down. Now her worst spot, which usually is the worst spot on all your patient, is right on her first area, so pushing from lateral to medial. She has probably even something on the right side too here, but the left one is a bit hotter. How are you gonna treat this point? In this point, usually you can ask your patient to help you a little bit to get into the position. Since this muscle, we know it's a side bender, what we want to do is to side bend the patient even more. So what we can ask the patient, if you could just side bend a little bit just with your chest. Okay, so in this way, she's side bending and she's approximating the muscle. I keep my point here, right on the tender point here. I bend her knee, put her knee against my thigh, so in this way I can help myself doing a little bit of compression. This will approximate even more the tender point. Then usually you grab the feet, and what you do from here, you just fine-tune the technique this way, so that when I push in, it's much more softer and there's no more pain. Another variation of this technique, sometimes you can just rest the feet on your thigh, put this hand on the iliac crest, and you can help in a little bit of compression this way or not. So you can play even in this way here if you are not happy with what you've gained before. Usually I use this technique for this first area, while I use this other technique here for the spot number 2 and the other spot number 3. You keep the patient 90 seconds in this position, which is the time for the neurological error to get again reset from the brain. And after 90 seconds, you're going to take back your patient in a neutral position. Well, the patient won't have to help you, so you have to go and do this passively. And usually the pain will be gone and the tender point will be melted or much, much less tension. You just keep it here. And every now and then, every 30 seconds, you can check again, and if you can ask her if she's still in pain. Usually if she had even other multiple spots, I can even search for the other spots like so, so to be sure that all the reflexes in the muscle are gone. This position is usually very comfort for the patient because many times the patient gets in this position to sleep too at night. You can fail with this technique if you put too much strain on this other side. So always ask your patient if they're comfortable. Sometimes they tell you, well, I feel like I'm a bit in strain in this area here. So what you just do, you just put their other leg more straight, so to decrease the tension here, and in other times you can even ask them to have their other arm get straight down next to her body. But she's quite flexible, so she probably won't complain about this. But if this happens, just remember to do this small adjustment here, and the technique will be much more effective. How's now? Better? Okay. It's okay. And then when 90 seconds are passed, you gently tell to your patient, please don't help me. You just relax like so, you get down, and you bring her back to place. And from here on, she can even help you getting back with her chest. And you search for the tender point now. How's now?
Fine.
Fine. No pain. And you can go much, much more inside. So this is how we treat a Quadratus Lumobrum tender point dysfunction.